Hi folks, State Representative Nino Vitale here. You've heard Trump made the opioid crisis a national emergency, and that's what we're talking about today. The opioid crisis, free tires, and Medicaid. Now, hang with me, I know that sounds odd, but wait until you hear what I have to say. First, a while back, I published 3 solutions to our drug problem: border control, drug companies, the FDA, and overprescription, and the breakdown of the family. I still stand by those 3, but I continue to look for solutions, and I have another to add to the list today for you to think about. It's Obama Medicaid expansion. What? How can providing health care to people contribute to the opioid crisis? Well, let me propose how and give you a little research to back up my ideas. First, though, let's talk about free tires. What? You weren't aware the government is giving out free tires? That's right. No more waiting until you hit those treadwear indicators on your tires, and no more picking those off brands. You can get free tires, all paid for by us, the taxpayer, in our great union. Any brand, pick the most expensive kind, and change your tires out anytime you want. Now, you probably haven't heard of this program because it's not real, although we do have one for cell phones. But I use it to illustrate my point. If there was such a program in place, do you think there would be more people getting new tires or less? Now think about this. If we were giving away free health care to people without restraints, they can go to the ER or any doctor as many times as they want, and they didn't have to pay for the visit nor the drugs they received, would they go more often or less often? Again, the answer seems obvious. They are going to go more often. If you have a headache, maybe you ask for some opioids. Have a pain in the back of your neck? Opioids. And might they just try to sell that on the street and not really use the drugs for what they say they need them for? Now, in case you think this is far-fetched, here's some proof. Data from the Center for Disease Control and Prevention shows that overdose deaths per capita rose twice as much on average in states that expanded Medicaid over those that did not. For example, in North Dakota, which expanded, it saw a 205% increase in opioid deaths versus its neighbor South Dakota, which only expanded by 18%. How about Ohio and Wisconsin? In Ohio, opioid deaths increased 39%, but in Wisconsin, which did not expand Medicaid, only a 2% increase. According to an Express Scripts Holdings study, large doses of oxycodone, methadone, and fentanyl can be obtained cheaply with a Medicaid card and resold for a nice profit on the black market. That same report, I found, turned up 261 defendants who had been convicted of improperly using Medicaid cards to obtain prescription opioids. I'd say another solution to our opioid crisis is to repeal Medicaid expansion and let the states decide how we want to run our own individual programs. So in review, border control, build that wall, President Trump. Find out the real nature of the addictive quality of these drugs and the breakdown of the family. And now this 4th one, full repeal of Obamacare Medicaid expansion. I'll be happy to come and override the governor's veto and remove expansion from our state. We have better programs that can use less taxpayer money to help those who are in need. This is State Representative Nino Vitale, and I thank you for watching.